All right, everyone, welcome back. I am happy to step in for the next part of our engagement today. I am your first keynote speaker for the day. My name is Dr. Rachele Hendricks-Sturrup. I am the Chief Data Governance Officer at the National Alliance Against Disparities in Patient Health, or NADPH for short. I'm also the Research Director of Real World Evidence at the Duke Margolis Institute for Health Policy. I am super delighted today to chat with all of you and share some work that I've done over the past couple of years to contribute to the topic of policy and ethics and innovation, with a focus on developing ethics and equity principles, terms, and engagement tools to advance health equity and researcher diversity in AI and machine learning. I'm also, after I talk more about the process of developing these items, I'm going to give you a use case that I believe is very important for everyone here to A, learn about, and then B, do something about. There will be a Q&A session at the end of my talk. So please feel free to jot down any questions or reactions you might have to anything I present today, and reserve it for the last 15 minutes of my presentation, where you'll be able to share those questions broadly with me and for everyone to hear. I'm not sure, I think we might have an online audience, but if we do, I'm not sure if they'll be passing around a microphone for those with questions, but nonetheless, please do feel encouraged to ask questions at the end of my presentation. Oops. I've got to go back. Sorry, 1 second. It looks like the connection dropped. As I wait for the connection to reestablish here in front of me, I'd like to share with you all a paper that was recently published in the Journal of Medical Informatics, Medical Information Research AI. It's on the title that you see here that I've already described as part of the title of my presentation. This was work This is work recently published in just in December of last year, where I was part of a working group within an initiative called Aim Ahead that is focused on, it's an NIH sponsored initiative that is focused on advancing health equity and researcher diversity in AI and machine learning research. And together within this work group, we were able to develop, as I mentioned, a set of ethics and equity principles and engagement tools, and also glossary terms that I and others across many other esteemed institutions, including those within this institution at Morgan State, and others at other researchers, very well-esteemed researchers at other institutions. We all came together and said, okay, what can we develop or agree on today as far as what should guide the practice of developing AI, or artificial intelligence, and machine learning within the scope of health research? What can be some guiding principles that should live within this program, and that should also inspire other programs to do the same, so that we're all working from the same foundational ethical principles? And so from there, still waiting, actually, if it's possible. Yeah.
So we're going to do a solution. You will advance, and then they will also advance. You have your own local copy. Just know that it's not in sync.
Oh, okay.
And you have to kind of pay attention to what slide you're on, so they can also advance for you.
Okay, sounds good.
You can give me a sign to go.
Apologies. But definitely keep everything I said in mind, because I've got a lot of really great content to show you all. Go up a bit more, scroll all the way up. This way. Yeah. Okay.
I can have this, and you can use this one.
Okay.
So you can give me a signal.
Will do.
So we can also
Okay, I'll say next slide. Okay. All right, thanks everyone for bearing with us. I think none of us are strangers to technical issues now these days. If you are a stranger to that, God bless you. But most of us are not. So anyhow, I'll give a quick overview of the background and rationale for this effort. I explained it a little bit already, but the first thing that this group agreed on was that AI machine learning is, in fact, and as you've heard today, not yet engineered to address all socio-humanitarian issues and complexities. That is especially true for individuals belonging to socially or economically marginalized communities. Their voices often go unheard, their data are often underrepresented for issues that are very systemic, that are deeply embedded in our sort of culture of social exclusion, so to speak. And really, for that reason, it's because of that, individuals who are part of these marginalized communities, they have limited engagement in research and discovery and innovation pipelines, which are necessary to cultivate shared prosperity. And so people belonging, again, to these communities might be particularly concerned that they'll be harmed by AI machine learning technologies. And in fact, there are some cases where that has happened. And that is usually in cases where the technology is applied without their awareness, especially if the technology is used to facilitate access to basic human services. And the lack of understanding generally about AI and machine learning and awareness of the bias that it can perpetuate, especially among, again, marginalized and minoritized communities, that results in limited trust in the technology, in the people that use it or implement it across a range of settings, and those who not only build it, but those who use it, those who rely on it, the systems that encourage their employees to make decisions based on it alone. We see that a lot in the health insurance industry, or really generally in the insurance industry these days. I have some work that's forthcoming on that topic. And so to build trust among those that are most subject to bias and risk of detrimental outcomes, especially in health research settings, there's a lot of history of bias and harm in health research settings for individuals belonging to minority communities, racial and ethnic minority communities. It's critical for AI machine learning developers, some of which might be yourselves, to assess their own reliability and adapt their practices to build trustworthiness with the most vulnerable stakeholders. So if it's incumbent upon you to build an AI machine learning tool, then you need to say, is this tool serving the least served or the most underserved member of the community, your community of interest? If you're not doing it with that goal in mind, then trustworthiness might be a problem. So I'll move to my next slide. That's my cue. Awesome. Okay. All right. So the purpose, again, of this work group initiative, again, this was the AIM Ahead Consortium's Ethics and Equity Work Group that I was a co-chair of alongside my colleague, Dr. Bradley Malin at Vanderbilt University. We created this work group in 2021 to guide the ethical and equitable development and also implementation of AI machine learning tools broadly within the consortium. We started off initially just as a small work group within just one of the cores of this consortium, the infrastructure core. They said, hey, you guys are making a lot of progress, you're gaining a lot of momentum here, why don't we bring you all, and this was Dr. Malin's idea actually, he said, let's just bring this broadly into the consortium, because the consortium itself had an ethics and equity work group, and we felt that instead of duplicating our efforts, let's just bring it all together, because all of this is very important, and the entire consortium needs guiding principles, not just within one core, but across the entire consortium. So I'm saying all that because I'm going to go through all of these slides really to show you how we were thinking and what we did, because ultimately this is going to hopefully inspire you to do the same and learn how to think about what to do, not necessarily just throwing a bunch of information at you. I will do that today, but it's more about just, showing you all how to lead, how to bring people together, because that is really difficult to do, especially in the sciences. And so again, we wanted to make sure that we developed something that would ensure that ethics and fairness are at the forefront of AI machine learning applications to build equity into biomedical research, education, and healthcare. Next slide. So our work group purpose and membership comprised in year 1 of around 50 members. In year 2, that dropped to around 40 members because the consortium itself started expanding its programs and people's time and effort needed to reshuffle a bit. Within this group in both years, we had members from a variety of academic disciplines and focus areas. So that included, but wasn't limited to, medicine, community engagement, law, human-centered design, health disparities research, social sciences, engineering, health science, data science, bioethics, you name it. So again, teaching you how to bring people together, make sure that you have people from a wide range of disciplines who have a concern and a vested interest in this topic. Because again, if you don't ensure that you have an appropriate range of disciplines at the table, then you can certainly miss a spot as far as not giving your effort a chance to be as inclusive as possible from an interdisciplinary standpoint. For example, if we just have doctors at the table to talk about this, and we exclude, people with bioethics or legal expertise or engineering design expertise, then arguably the AI machine learning tool is going to have some blind spots once you go to implement it. And then next thing you know, surprise, we have a biased tool. And so again, ensuring that a wide range of disciplines are represented within your effort and within your group, it's extremely important. Next slide. I think the slide before that. There we go. All right, so to develop the principles, the entire work group contributed thought leadership. So we sort of functioned as what's called a brain trust, where again, a wide range of experts across many different fields came together to engage in a very systematic approach to react to relevant, published content as a way to inspire ourselves to devise actionable principles. And so we met during year 1 weekly as we got started and gained momentum and said, okay, let's really roll up our sleeves and talk about not just the issues at hand, but what we're going to do about it. And then in year 2, after we had made a lot of progress, we said, well, let's start meeting bi-weekly so that way we can continue to suggest, review, and deliberate around the extensive corpus of documents we've gathered together and start doing more work on paper. So less talking, more doing. So that meant that less meetings, but more interaction in shared documents, more interaction through emails, getting pen to paper, and putting diagrams together. Like, we were doing the work at that point. And so these weekly meetings in year 1 led to consensus around the development of specific work group deliverables. We put together our charter. We completed a literature review across a wide range of sources, not just peer-reviewed sources. We also looked at what large companies were saying about ethics, like Google, for example, and AI machine learning. We brought it all together to say, okay, what is resonating with us the most? And I'm happy to say that what resonated most with this group is work that NADPH did with early before AIM-AHEAD began. They were most inspired by some work that we did under an initiative called RECODE, which is short for Rising Equitable Community Data Ecosystems. That work was very heavily qualitative, meaning that we did a lot of interviews with people nationally across our country, the United States, a lot of people that were boots on the ground, community people, community representatives. Some of them had intersecting identities where they were from marginalized communities. They were also technology developers and also leaders within their communities. So we got lucky with a few unicorns that we brought to the table that could really contribute ideas. And the work group here was inspired so much by that work and some of the foundational principles, or rather recommendations that we felt could be transferred into foundational principles, that they said, let's go with that because it's community-led. This is what communities are saying, and this is what's resonating with us the most. So we took those we took that work, considered all of the other work alongside of it, and we identified, other lessons that could be gleaned from other pieces of literature that would inform the development and use of AI, machine learning, and health disparities and disease prevention research. We engaged in what's called a modified Delphi approach to facilitate our discussions around tangible next steps that the consortium should take to ensure that ethics and fairness are at the forefront of AI machine learning applications. And again, that is all with the goal of building equity into biomedical research, education, and healthcare. So I'll move to my next slide. Here is a very abbreviated list of our 5 core principles. Each of these principles have their own subparts, very much fleshed out subparts. I encourage you all to scan the QR code that you see here. It'll take you directly to the JMIR AI paper that lists those principles and their subparts in great detail. I cannot fit all of that into slides. I'm not going to do that to you all today. So certainly feel free to scan this QR code and it will take you to the paper title that I showed in my earlier slides. But essentially, here are the 5 core principles that articulate best practices for working with stakeholders from historically and presently underrepresented communities. First, build trust. Well, these are in no particular order, but first I'll mention the top bullet. Build trust with communities. Do that to make sure that you are trustworthy. And that goes for all of you. That's not to say that just because you belong to an historically or presently underrepresented community, that's not to say that you're still trusted, among other communities. So take the time, build into your if you're submitting grants, build into your budgets time needed to build relationships with the community. The last thing communities want to see is you just show up with an idea and then you go there, execute your ideas with them, and then leave. That's called value extraction, not value creation. What you want to do is value creation. And so from there, that takes me to my second bullet: design and implement the AI and machine learning tool with intention. You can only do that if you've taken the time to make yourself trustworthy, and in order to build and sustain trust with the communities that you're a part of or that you are intending to work with. Co-create solutions, do not dictate solutions. Do not show up to communities saying that you have the silver bullet, you have the latest and greatest panacea to whatever problems you think they have. Please don't do that. Do not dictate it. A lot of times we hear the traditional, I think it's, no offense to engineers, but I think engineers love to say, if we build it, they will come. Cool, that's fine. If you're building, like, I don't know, a playground or a restaurant, I'll probably come, that's true. But when it comes to something like AI machine learning, that just does not hold true, and it shouldn't hold true. So do not dictate solutions from the top down. Build the solution with the community's best interest and with the community's needs and goals and desire for opportunities in mind. And do that in a sustainable way. Make sure, again, you're building into your grant or project proposals time to do this. This is what I see as the most overlooked part of doing this work. People are not putting time as far as cultivating relationships, building trust, being your whole authentic self with these communities. You're not putting the time to do that. So make sure that this is goal number 1 of yours. Do that with the intent to build capacity. So again, don't just show up to the community gathering data about them. You build a tool and then you just take it somewhere else and don't do anything about it, and you don't empower those communities after that. They're left with nothing, you're left with everything. Do not do that. Build capacity, understand how they might want to be a part of this moving forward. What is the goal as far as making sure that folks in the community are trained in order to sustain whatever AI machine learning solution you've co-developed or co-created with them? How do you think about creating jobs, creating sustainable education, creating opportunities for fellowship or just community engagement initiatives? How are you thinking long-term about your solution with that community versus just showing up and leaving because you got what you needed? And reset the rules. Think about the power dynamics that exist between communities and the large institutions that are anchored in those communities. A lot of times there are anchor institutions that exist within, smaller minoritized communities, but those anchor institutions aren't really doing much to build up that community. And therefore, there are power asymmetries at play, meaning that the institution has a lot of power over the community, but the community doesn't have that same power over the institutions that are embedded geographically within the community. So reset the rules. What might that look like as far as power sharing? Information asymmetries as well. How are communities and institutions sharing information with each other, because information is power? Think about all of that. And again, please feel free to scan the QR code where everything I said is put into great detail in further subparts. Next slide. All right, so now talk about the glossary that we developed. So first, we define ways in which outputs of AI machine learning can fail to be informative or useful to certain groups, instances where it can distinguish among individuals in inappropriate ways that, as a result of bias or failure of inclusion or misuse, be poorly vetted by individuals or groups who might be subject to potentially harmful actions or decisions made by key authoritative stakeholders, again, thinking about the power asymmetries. And so we used, again, a modified Delphi approach that involved polling, ranking, and other group exercises to reach consensus on terms to define. This also included not reaching consensus, or what we call intractable disagreement, where we said, okay, well, these terms might be okay to define, but we all, I think, agree to disagree on some of these terms. So sometimes everything's not gonna be smooth and positive all the time. There might be some culling that needs to be done when you do work like this. So expect that, don't be offended by it. It's just, that's what happens when you're building consensus through stakeholder engagement. So we identified possible terms that would be key to define to inform the ethical and equitable development and application of AI machine learning. We engaged in rounds of, again, ranking and polling exercises to narrow the group's suggestions down to 12 sentinel and conceptualized terms. Next slide. Here are the terms here. So at the center of this diagram, there's equity. We defined equity as something that requires fairness in a population with sufficient diversity. So fairness and diversity function within the scope of equity. A representative sample and a representative, which we use as a noun, being a local concept to focus on an individual. We also felt that those terms and concepts go into the term diversity. And then from there, it branches out into diversity being a function of, in many cases that we discussed today, ethnicity, race, gender, and sexual orientation. And then algorithmic bias is a form of general bias, which can lead to inequity. And also inclusive, that term aims to avoid bias by enforcing fairness. So all of these terms, although they can be defined individually, they all function together in one sort of systematic, in this sort of schemata that you see here. This is a diagram that we discuss in more detail in the paper as well. So feel free to read there, and I'll move to my next slide. Now, realizing that our work will require further iteration today and into the foreseeable or extended future, we developed an interview guide that we felt would be helpful to help stakeholders guide those discussions as they iterate on the principles or figure out how to implement them locally. Initially, we had sought to develop a more of like a quantitative survey to assess how aim-ahead researchers would implement the principles in practice, but after doing some pilot exercises around that, we quickly learned that a survey would be premature and not helpful. And so we listened to the communities to say, what might be helpful? And then again, that's why we landed on developing a qualitative interview guide. As again, we felt it would be a more useful approach to garnering aim-ahead researchers' perspectives on implementing the principles in practice. Also, the guide is a tool, again, as I mentioned, to help iterate on the principles themselves and the glossary terms as well. Another observation of mine in leading this work was that the principles were never finished. We got to a point where we said, okay, we're done. Like we need to stop making edits. We need to there's a lot of people, this is what happens when you have a lot of people at the table from a lot of disciplines. Everyone wants to keep going and keep iterating, and a lot of times that can lead to what you've developed being very watered down and not really saying anything, or them not having, your principles not having as much teeth as you intended from the start. And so we had to agree that as a group, we're done making edits, no more edits, from here. And so we said this interview guide is one way for, again, people to take the principles into their local settings and iterate from there, and have the interview guide is meant to guide discussions. And so we felt that would be most helpful rather than just ourselves going back and forth for many years or a lifetime on, iterating on the principles. And again, the interview guide was created with the intent of learning from interviewees their perspectives and natural reactions to the ethics and equity principles and glossary. Next slide. Here is a snippet of the interview guide itself with some example questions. Again, this is included as a supplement in the paper that we published. So it asks, for example, can you describe to us which principle resonates with you the most? Can you describe which principle applies most to your work or least to your work? These are just some example questions, that are not yes or no questions, and that really encourage people to elaborate and think critically about the principles as far as local implementation. Next slide. There are some limitations to our work. Again, as I mentioned, these are living documents. The principles are part of living documents, and that complicates the process of achieving sustainable consensus. The work group, as I mentioned, continuously revisited the principles and glossary for potential editing based on their evolving experience and expert opinions. And again, AI machine learning is a very fast-moving, fast-developing technology. So it's very understandable that the principles would need to keep up with that. And also, some of the glossary terms that I shared with you might already be limited in scope with respect to real-world events and phenomena. So, for example, our definition of representative concerns, again, we use it as a noun. It concerns an individual or body chosen or appointed to act or speak for an individual, population, or subpopulation. However, keep in mind that in some places and in some settings, there are certain matters in which a representative may be self-appointed without specific authorization from their representatives. So please keep that in mind. That would be called a dictatorship or something like that. Keep in mind how those types of settings can creep into goals that you're trying to accomplish. And again, make sure you're actually going to the communities, spending time with them to learn, again, what their goals are, not what the most powerful person in their community is saying. Person or entity, that is. And I'll move to my next slide. Now, I'm really happy to share that our principles actually made more impact than we originally thought. In October of last year, the U.S. Office of the President issued an executive order acknowledging the fact that AI reflects the principles of the people who build it, who use it, and the data upon which it's built, substantiating the need for programs that embody the spirit and mission of those like Aim Ahead. So we were happy to see that. Also, we realized and found that in December of 2019, so several years ago, the NIH Advisory Committee to the Director Working Group on AI, they published a recommendation that NIH, or the National Institute of Health, charge a new or existing working group to develop a set of ethics principles for the use of machine learning in biomedicine. So we said, hey, wait a minute, we did that. Our work has helped make progress toward and continue the work set by both the White House executive order and this NIH working group. And so we have a paper forthcoming to describe how our principles have made progress towards this goal and should therefore be heavily considered in any forthcoming progress that our government would like to make around AI machine learning implementation in biomedical research settings. So yay us. Next slide. So I'm really also happy to share that as we developed the principles, and this was before we published them, and while we were still disseminating them within our Aim Ahead community, we hosted a roundtable discussion that was a tremendous success at Fisk University this time last year. In fact, I think it was like exactly this time last year. We hosted a roundtable discussion on the topic that you see here, where we felt, again, this was part of our goals to prepare the next generation. This was a roundtable discussion that had an audience that was 90% undergraduate students, in fact. It was on the topic of diversity, ethics, and equity in AI machine learning uses for healthcare and research. Is it real or is it hype? And so that event was attended by over 200 Fisk University students. And part of their attendance, given that they attended this event, they were actually able to receive professional development credits toward graduation. So we're happy to have contributed to their success in that regard as they graduated and matriculated into other programs that year, or the workforce. And the students and faculty in attendance expressed excitement and enthusiasm and also eagerness to learn about career options and pathways for AI machine learning and health research. They were interested in learning and asked a lot of questions about how AI machine learning intersects with health equity, how it's being used to advance the practice of medicine and health research. And we did a really deep dive on the ethical issues as we've done today, as we've sort of done today, accompanying AI machine learning implementation in underserved healthcare settings. We talked about a lot more areas, or we discussed a lot more areas in that regard, but it was a wonderful event. The following day, I was giving another keynote for their honors convocation, going over the principles in great detail, more detail than I've done today, but there is a recording of that if anyone would be interested in seeing it. But it was truly an honor to see just how inspired our next generation of students, and also faculty who were present as well, who were also learning about this. So they were new to this topic as well. It was really great to see just how informed and inspired they became after that weekend of events. Next slide. So now, I'm not over time, am I? I know we had technical issues, but I'm going to spend the last portion of my talk discussing some research that I've done over the past several years, actually, that's led up to this point that I'll share with you all today on work that I've done with the members of the National Black Nurses Association and the All of Us Research Program. Where All of Us, if any of you have heard of it, it was born under what's called the nation's Precision Medicine Initiative. That was born out of our 21st Century Cures Act. And so this is considered a 21st Century Cures Act innovation. The All of Us Research Program serves as a data platform and resource, therefore a resource for research and discovery, and serves as the basis for the return of individual health-related DNA testing results to participants engaged in the program. The platform itself meets the U.S. Food and Drug Administration, or FDA's, criteria for a significant risk device study, which is really cool. That tells us that there's a lot of potential to identify new molecular or drug targets by leveraging this database. So to date, the database has over 413,000 participants. There are two tiers through which individuals like you really can access data. Through the public tier, or its public data browser. It's just publicly available online. Or if you're at an institution that has an agreement in place with All of Us, you can access the researcher workbench. This is a very diverse, or at least the data platform itself contains data from a very diverse cohort, where 75% of the data is from at least one underrepresented minority category. And the data is comprised of data from various sources. So whole genome sequencing, surveys that individual participants have taken, physical measurements, and electronic health record data. Next slide. And so one thing I want to mention about findings that I've seen today, that others have seen today, is that to date, the All of Us Research Program has enabled the identification of over 275 million new genetic variants. Well, they're not new, but they're genetic variants that are new to us, meaning that they don't have presently a significance assigned to it. So they're of undefined or uncertain significance. And because of that, there's a lot of opportunity or potential for AI machine learning to sort of close that abysmal knowledge gap. Most of the variants of uncertain or undefined significance are from individuals of African descent or ancestry versus others. And so, therefore, the importance of what's called pharmacogenomic variants or genetic variants, again, with implications for delivering medicine or drug therapy across a range of therapeutic areas. The importance of pharmacogenetic variants among individuals of African descent is poorly understood. So it's one thing of contributing your genomic data to contribute to generalizable knowledge and facilitate the discovery of undefined variants. But if we don't do something about it, meaning that if we don't implement that knowledge in ways that allow us to gain a better or more solid understanding of therapeutic potential for communities, then what's the point? And so AI machine learning, again, has the potential to address this knowledge gap and increase the likelihood of returning actionable results in an ethical, humanistic, and culturally competent manner. I'm going to talk about that next. Next slide. So also in December, I published another paper based on some research that I've done through a grant that I received from the All of Us Research Program on returning personalized genetic health test results to individuals of African descent or ancestry in precision medicine research. So this was work that I did and that I continue to do at Duke University in partnership with my colleagues at Harvard Pilgrim Healthcare Institute, which is my former institution prior to coming to Duke, part of the Harvard Medical School community. We came together for this project and conducted a literature review that would inform some ongoing qualitative interview work that we're doing now. But given that there's a dearth or low amount of studies on return of actionable or just general research results with a specific focus on individuals of African descent, we sought to explore the literature to examine or identify studies that examine the disclosure of both clinical and research-grade genetic findings. We conducted a thematic analysis of literature review results. So what we did was identify studies that were conducted, and we did a qualitative assessment of their findings, sort of like a meta-synthesis and meta-analysis of those findings of each, and we took into specific consideration the authors of those papers' recommendations for our qualitative analysis using deductive data coding. The resulting codes were built into two themes, categorical and actionable themes, and I'll discuss that in my next slide. So our literature review results show that there are just a very teeny tiny amount of studies published. Most of them, or all of them rather, were published between 2012 and 2021. There were a total of 6 studies focused on return of research versus clinical results among individuals of African descent. 3 studies in our review were from a single study in 2012 that involved 45 participants. Across all studies, the number of participants of African descent ranged from 41 to 48. 4 of the studies were conducted between 2012 and 2014, and 2 were conducted in 2021, prior to the All of Us Research Program returning results to their participants in 2022. 5 of the 6 studies were qualitative, and only 1 focused on return of results in adult versus pediatric populations of African descent. Next slide. So here are 2 major categorical themes: motivations to engage or disengage in research. There's some sub-bullets here. And then integrating research into care. One main finding there is that in the event that people are involved in research, if there's a lack of access to follow-up healthcare, then that might hinder the participants' ability to address actionable genetic findings. And then here, lastly, this is my last slide, are some actionable strategies to further support individuals of African descent engaged in this research. Support the system and educate and personalize the process. That means, at minimum, provide system support to address the psychological impacts or burdens following return of genetic results, and also personalizing the process such that you're thinking of ways to, for example, discuss the religious or spiritual beliefs that exist around disease manifestation and how that connects to one's belief or understanding of their genome. And that being said, I will end my presentation, and I think we have time for questions. We have a microphone that folks can pass around. Thank you.
All right, thank you so much, Rachel, for coming on and giving us this really thoughtful and enlightening talk. We are really grateful for your participation. We have time for maybe 1 or 2 questions before we introduce Michael Running Wolf. So if you have questions, raise your hands, or if you have comments, and I will come to you. I'm dressed to run to you if needed. All right, so thank you again. Oh, you do have one. Yes. Yes. The question was, will we be able to have access to the slides for the talk? We will. The slides will all be added to the app.
Thank you so much for a very informative presentation. I have a question about the research where you mentioned that do not dictate, like build with them. So, so a little about me. I'm the lead UX designer in the city of Baltimore. We work for the mayor's office, and in design, we have a saying that build for people, build with them, not for people. So my question is, do you have any suggestion how to actually implement that or sell that idea to the leadership? Because often when the leaders see anything, they actually have an idea and they have a goal to achieve it, but not necessarily like have the perspective, or it's not intentional, but probably not have bandwidth or time to actually go and talk, like build with people. So how we can break that barrier and have leadership buy-in to implement this technique?
Yeah,
Thank
that's a really great question. And in fact, where I disseminated some of that early work that informed or enlightened the principles that I shared with you all today, I presented this work at various conferences and did a poll, and I said, even though our data shows that by engaging what we call persons with lived experience in the data and product technology development lifecycle, it results in more equitable data practices. Our data showed that. And we did a poll to ask the audience, okay, well, we all know that this is an aspirational goal of ours, but how easy is it to do? And most of the participants said that it's not easy and they don't know how to do it. And so I think it's incumbent upon us moving forward to identify instances where doing that has been successful, and what did that look like? What is the framework? I mentioned earlier that one way to think about this is to embed the engagement in the process. A lot of times we just want to have the idea and get to the results. That's a huge problem, not even just AI machine learning research. It's a huge problem in research in general, especially community engagement or participatory research. So there need funders and project leaders need to be convinced, and we need to do a better job at convincing them and educating them on why this is important. We need to highlight the successful use cases that we all should encourage come forth to inform our communities, because again, there is data to show that it results in more equitable data practices, more equitable product development, more inclusive technologies as a result. We just need those successful cases to come to light. And again, we need to think about who we're putting into positions of leadership, and what we're doing to develop them professionally to understand this. But an easy answer to your question is embed it in the process as much as you can, and do that, substantiate that by, again, citing or highlighting successful use cases of where that has been done to make your case.
Thank you so much. And I'm just going to add one last thing, because Rachel and I work very closely together on this. There's a saying that applies here, and it's from the community with people who have different abilities. And it is nothing about us without us. So consider that as you plan. And thank you so much, Rachel.